Hello, thank you for joining me today. This video is going to be about facts concerning tardive dyskinesia, so you might want to get a pen handy and paper so that you can write this information down. A little known fact that I found out is that tardive dyskinesia is different from Parkinson's disease in that people with Parkinson's disease are unable to move, whereas people with tardive dyskinesia can't stop moving. Both of those are neurological disorders, but that is one way of describing how it's different from Parkinson's, because I know many people thought I had Parkinson's disease when I first moved into my apartment especially. Another thing that I want you to know is that there are a few antipsychotic medications out there that can cause tardive dyskinesia, so I believe that you should read the contraindications thoroughly so that you know what you're getting yourself into before taking the medication. Do your research. That's very important. There are 3 drugs that I found out currently that I know of that can cause tardive dyskinesia, and that is Geodon, Invega, and of course Reglan. Tardive dyskinesia is also more common among women, and men over 50 have a more difficult time controlling the tardive dyskinesia. Now we know that there are medications for people with Parkinson's disease that also work for people with tardive dyskinesia, as in my case. It was a great help. I tried getting off of it and it didn't work out for me. I obviously need the medication, and with the medication I can lead more or less a normal life as long as I don't have anxiety and I don't get I'm not afraid and I'm not worried about something. I'm okay. I know now I can't handle large crowds, so I usually take my medication prior to going anywhere where there's going to be a lot of stress, and I may even take my Benadryl to keep me calm. But ask your doctor before you try to do any of these things. I work with my doctor, so please make sure and ask your doctor. Another thing that you need to know is that Reglan was noted in 2000 and I want to say 2009 that the FDA issued a warning concerning Reglan. Basically, people that took Reglan for more than 3 months developed tardive dyskinesia. That's a very important fact. And so they don't recommend anyone taking the Reglan for more than 3 months. And another one is that once you get tardive dyskinesia, there is no cure. It's incurable. But we have learned that the blue sunglasses may work. I'm going to buy some glasses pretty soon, and they're going to be prescribed, but I'm going to make sure that they do have the blue tint in it because I still want to try. And also, I know that taking the clonazepam helps. So if you're taking medication and it seems to be working for you and controlling your tardive dyskinesia, keep doing it. Also, don't stop exercising, because I realized when I stopped using my leg that my tardive dyskinesia got worse. My legs, I just couldn't use them. So if you don't use them, you lose them. So even if your hands and your body's moving continually, try moving them more slowly. Like Tai Chi, practice slow movements. And if you have to, like I said, with little cans of corn or whatever, but do it, because that's very important. You need to remind your body what its job is. Another thing is that people can develop withdrawal symptoms. Let's say you're taking medication and it seems to be helping, and you may go through withdrawals after time. Maybe you've slowed down or cut back, so you may go through withdrawal symptoms. You may relapse, which in my case I relapsed after decreasing my dose of clonazepam, and then and also tardive dyskinesia can lower your life expectancy. So exercise is key. So eat healthy, Take care of your body, take care of your mind, because you need to know that tardive dyskinesia can cause a syndrome called neuroleptic malignant syndrome. Okay, with this syndrome, you could get high fever, unstable blood pressure, delirium, and then ultimately coma and death. This only happens in 1% of the population that develops tardive dyskinesia, and only 20% of those are fatal. So most people, this is a well-known fact, that have tardive dyskinesia are often isolated, they're depressed, and they have difficulty managing their TD. So these are just a few facts that I wanted to tell you about. I'll talk to you more about this in another video. God bless, have a good day, and you take care.